Uh-oh. My bad, y'all. Gotta adjust. What's up? Today, we're gonna be reacting to Dennis Prager. Uh-oh. Wait a minute. Okay, hold on. Yeah, man, you gotta keep moving this thing. Boom. I think that should be good right there. Boom. Alright, so we're gonna be doing Dennis Prager. And he's gonna be why Obamacare doesn't work.
We will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan, period. We weren't as clear as we...
Hold on, before he goes on. If you like your doctor, because I've heard this talking point so many, the conservatives use this talking point so many times to try to destroy the conversation of Obamacare. And it's not called Obamacare, it's called the Affordable Care Act. I want the people in the Appalachian Mountains that use it to know that it came from Obama. And it was really to stop basically companies from, stop insurance companies from being able to reject people with pre-existing conditions or any kind of thing like that where insurance companies injected for, and give everybody the ability to be covered under some kind of healthcare plan, because every other first world nation in the world makes healthcare a right. We're the only ones that make it within capital, and the system will fight profit-made organizations that put profit over a person's health. And I think that's definitely what it was. And that's why I think the Affordable Care Act came out. That is the point of it. Is it expensive? Does it have its problems? Yes. Do other countries have their problems with their healthcare plans? Yes. But I don't think anybody would disagree that everybody should be able to have the ability to have access to healthcare. That's what it was going at. But let's see what Dennis Prager has to say about it.
Needed to be in terms of the changes that were taking place. And I am sorry that they are finding themselves in this situation based on assurances they got from me.
It's very easy for a politician to stand up before voters and say health care is a right, and then passionately advocate for single payer.
Before he goes on, I want you to notice that Obama owned up to when he said what he said earlier, and he realized that the promise couldn't be met up. He apologized to the people. Give me one time Trump has done that so far. Tariffs are going to make our prices go up. No apologies. He wanted to completely eradicate. Let's talk specifically about healthcare. He wanted to eradicate and replace healthcare. And thank God John McCain was stepped outside of party and realized you're about to throw at least 5 million people off healthcare. John McCain said, no, we're not going to do that. I just think that I miss a president that owned up to what they did wrong and stood ground on it, and we felt where they were coming from. And even if you don't like everything that he did, you have to admit that that was a beautiful thing.
Or free health care, or Medicare for all, whatever term they might use. But before we consider the merits of the government managing your health care, and that's what this all boils down to, maybe we should ask a more basic question. What do we mean by health care? Because if you get sick, and here we're talking major illness or you're in serious pain, you don't just want health care, you want quality health care. And where is your best chance of finding that? The answer is right here in America. For skilled doctors, cutting-edge medical treatments, and care without long delays, no other country rivals the United States. Not even close. Nobody from Texas is going to Canada for medical treatment. It's almost always the other way around.
That's actually not true. There was a group of people that came from, I think it was from Ohio to Vermont, and I think they went with Bernie. I was reading about it in his book, and they went up to Canada to get coverage, right? And they went up to get healthcare coverage. They went up to get insulin, and they went up to get a bunch of other things done that were, to test their healthcare system. And what they found was, yeah, there are some times where you have to wait a certain period of time, but the healthcare was just as good, if not even better. And insulin specifically was almost what? I think it was 40-50% cheaper than it is here. So insulin is something that some people need who are diabetic, is way more expensive in the U.S. than it is over there, and they could charge whatever price it wants because there's nothing like regulating or keeping them from getting where they need to go. The question of what kind of healthcare do you need? Why can't we just get it started and then work on building it to a better healthcare plan if it even starts off bad? I don't know. It's like they don't even want to start the game. They don't even want to start it. It's weird.
Sure, our healthcare system has lots of issues, and we should address them.
It does.
But do we really want to upend all the advantages that we do have and start from scratch? Because that's what would have to happen if we completely turn healthcare over to the government.
No, it doesn't. No, it doesn't. It doesn't have to completely go away. Just it's only certain things. Like for example, when he implemented Obamacare, he didn't get rid of insurance companies. He regulated what insurance companies could do, like how they could bring people in and how they couldn't bring people in, and what could be subsidies for them. He opened up a program in the government so that people can have some type of healthcare connected to it that some businesses took, and it threw some of from what I heard, it threw some insurance companies out of business, which is okay, like that's something we should work on too. Do I care? No, because you're giving somebody the ability to be able to go to the hospital. I don't care what happens to their business, to be honest, when it comes to healthcare specifically. I care what happens to the people that need to go and get heart surgery, get insulin, get the things that make their lives better. Shit, hell, I even would go as far as we should add dental into this. Dental, I think, is a form of healthcare. I think mental health is a form of healthcare. I think all these things need to be taken care of. I mean, anybody who argues with me in the comment section on this one is going to be a joke.
So let's imagine we make the change.
Okay.
We hear a lot about how great free healthcare would be, but it's only fair we look at the downside. The first is that government-run healthcare takes medical decisions away from patients, that means you, and puts them in the hands of bureaucrats. They decide, for example, how many MRI machines are going to be available, or under what conditions you can get back surgery or a bypass, or even whether you qualify for cancer treatment. That's how it works in the United Kingdom under its single-payer system. Because it has finite resources, the National Health Service, or NHS, sharply restricts access to treatments like hip and knee replacements, cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes. If you suffer from any of these ailments and many others in the UK, you may just have to live with the pain. And let's hope you don't have a medical emergency.
That's just all around the board not true. I actually know a lot of people from the UK, specifically because I was actually debating a bunch of people about the UK's healthcare system, because I was thinking that we had a better healthcare system than them because of the things that he was telling me, right? The data didn't show that. The data showed that everybody that needed every one of those categories was covered. That's what the data showed. Are they a much smaller nation than we are? Yeah. And that could be it, but that's not what the data showed. It's not what the data showed.
In a January 2018 article in the New York Times, patients in emergency rooms around London are described as having to wait 12 hours before they are tended to. Corridors are jammed with beds carrying the frail and elderly. To deal with the situation, hospitals were ordered to postpone non-urgent surgeries until the end of the month. That hardly seems like an improvement over what we have in the US. A second big problem with single-payer systems is that they are expensive, really expensive. A recent study by the Mercatus Center at George Mason University found that a Bernie Sanders-style Medicare for All health system would cost a tidy $32.6 trillion over 10 years. That's on top of what the federal government spends on healthcare today. And this is not a new number. Other studies have found the cost to be roughly in the same range.
It's interesting because they're doing the studies. I've read some of the studies, and they're good. They're good studies, but they're doing it based on and this is what they don't talk about. He talks about in this book, because everything is always trying to destroy Bernie, what Bernie was saying. But they're doing it based on all across the board, everywhere, healthcare, no, nothing, everything going on. And I don't think everything, like the entire nation completely covered with healthcare, which is something that we should eventually lean towards. But Bernie was kind of saying, like, let's slowly start getting this. Let's slowly start doing things like Big Pharma not being able to just jack the prices on prescription drugs whenever they choose to. Let's slowly build towards areas where you can deny somebody coverage just because they have a pre-existing condition. Let's slowly build towards the area where when you walk into a hospital, you get treatment. Will you get the bill later? Of course. But is there something that can help you subsidize the bill so that you don't feel uncomfortable to go to the hospital? Let's slowly build towards these things. And slowly but surely, people will, in his opinion, will like it so much that eventually we'll be able to put more money into these things and be able to work out the kinks that are caused by these healthcare problems. However, though, again, like firing back up at Canada again, because Canada was one of the biggest things he used. He used Canada, the Netherlands, and he used Britain a couple of times. But Canada was a really good example of this. And in Canada, yeah, like sometimes people have to wait a certain amount of time. They have to apply ahead in order to get in. However, though, the treatment that they get is still pretty good, if not better, than the treatment that happens in America. That was literally what he found. And I may not die on that hill if somebody could prove me differently. I do think America has a really good healthcare system. We do. No, not healthcare system. I'm sorry. We have a really good. Actually, I don't know. Actually, I've never actually researched to see how good America is. When you go to the hospital, do you get the treatment that you need? Never really figured that out. But let's keep going.
So, how would we pay for it? Kenneth Thorpe, a professor at Emory University and health policy official in the...
Two ways. I can actually answer this. Bill and Bernie Sanders did. A tax on Wall Street speculation, right? The tax on Wall Street speculation is going to be where any trade that's happening on Wall Street, any stock that's bought, a percentage of that stock is going to go back to the American people. The increase, of course, on capital gains tax, unrecognized gain tax. Literally, overall, those three taxes alone, right, could literally bring in $5 trillion for the American people. And I've seen the data. They literally can do it. They can literally bring in $5 trillion for the American people just off the strength of taking that money away. I don't want to say take it away, but taxing people who make a little more in this country in order to help the people at the bottom. And I think... I know like that argument people make, but I really do think that if you're patriotic, you should really want to do that anyway. I don't know. I want to do that. I want to definitely put as much money into helping everybody else around this country as possible, as long as it's helping people and getting people to the next level. That's what matters to me.
The Clinton administration spells it out. If you are going to go in this direction, Medicare for all, the tax increases are going to be enormous. Not just for the rich, Thorpe estimates, but for working Americans and the poor too. Mm-hmm. Charles Blahous, the author of the Mercatus study, puts it this way. Even a doubling of all projected individual and corporate income taxes would be insufficient to finance these added federal costs. And he considers that a conservative estimate. Canada knows all about exploding healthcare costs. In Ontario, the country's biggest province, those costs took up 46% of its entire budget in 2010. By 2030, that number is projected to be 80%. In other words, in a few years, Ontario will have little money to pay for anything except health care. Finally, and perhaps most importantly, government-run systems depress the search for new cures. Biomedical research spending in the U.S.
That's just not true. Hands down, but I'm listening to what he's saying.
Far outpaces that of any country with nationalized health care, even when you account for differences in population or size of economies. That's one reason medical breakthroughs rarely come from countries where the government controls healthcare. They come from the United States, where the government doesn't. The lion's share of biomedical research and development spending in the U.S., over $70 billion in 2012, comes from the private sector. Discovering new medical cures and technology is a profitable business, and thank goodness it is. Those profits drive innovation. Take away the profits, and you will surely take away the innovation. Single payer, free health care, Medicare for all, they might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good. I'm Lan Hee Chen, fellow at the Hoover Institution at Stanford for Prager University.
Well, it's not, they don't produce more harm than good, man. Like, because everybody up in Canada, even though the cost, I'm going to look into that, if the cost is that bad, but even though the cost is the way it is, everybody up in Canada still likes the fact that they can go to healthcare, go get healthcare and get it done. The argument for some people to move to Canada, out of Canada, is the fact that will they be covered by healthcare in the U.S.? They won't. Not coming in here right off the bat. It takes time. I mean, this is definitely a conversation I've been studying for years and years and years and years and years and years. The only thing I haven't really looked into, I know we have an excellent healthcare system here. I keep saying system because I know you're going to fuck me in the comment section on that. We have a definite, you go to the hospital and you do get treatment. We have that kind of a system. I just don't know how good that system. I mean, people come from other countries to come here, so that would make it clear that we have a good system. I also think because we have a lot of money in this system that it makes it easier to. It's a lot, you know. It's so much going on in it, but Hey, I'm out. Peace.